Health insurance lessens the inequitable burden of healthcare spending, especially for the rural poor with unpredictable income. However, in Uganda, health insurance is not well appreciated, particularly by people who are not in formal employment, making it difficult to access quality health care. Save for Health Uganda, a non-government organization, has demonstrated that people can access quality health care through community health financing schemes. Indeed, in Luwero district, local leaders have appreciated the community health financing schemes, saying that they have contributed greatly to improving access to quality health care.
Therefore, sincerely, our community has benefited in this insurance, and I'm trying to request our residents of Luwero district that we should come up and join the self-health project such that we decrease the amount of money which we spend on health.
Agnes Nansozi from Chizito Zone in Luwero Town Council is a beneficiary of a community health savings scheme called Muno mu Bulwadde and says that women have benefited greatly.
I've been in self-health for 2 years. I was expecting my baby and I got a cesarean birth. Self-health has helped us as a family, not me as a person only. My in-laws, the children.
The saving schemes, through their leaders, choose health service providers who they think give them the best treatment, and in Luwero, Bishop Caesar Asili Hospital is one of the service providers contracted by the schemes.
Chose their leaders. They have their structures there. They chose the leaders came, negotiated with us, and we signed agreement. With each scheme, we sign agreement for what services we should be providing and the costs of services. So from 2008, they continue to renew the agreement, and there are new schemes also who come on board.
Bishop Asili Hospital started with 2,000 clients in 2008, and the number has now hit 31,000 and still growing. According to Sister Ernestine Akulu, the administrator of Bishop Asili Hospital, the community health saving schemes have improved on the health-seeking behavior of the rural poor.
From the side of the patients is that patients, they don't fear to come to the hospital, because they know they are already covered. They pay the premium, they are not going to pay for the services. When they come here, they just get treatment, and at the end of the month, the hospital bills the Muno mu Bulwadde union, and the Muno mu Bulwadde writes a check for the hospital to pay. So the patient does not incur any cost here. So in this way, patients have also learned better health-seeking behavior. They come early. They don't wait, let me first look for money. Meanwhile, the condition is getting worse. But they come early and they treat themselves early enough without getting complications. So this is a big help for the community. But the best help for the community is that the community, and they don't now have to sell away their things from home. People sell land, they sell animals, they can sell anything in order to pay for bills in the hospital.
Health facilities also benefit in a way that the burden of treating complicated illnesses is reduced.
Hospital also, in this way, since people seek for health early enough, they don't have to spend much treating very complicated cases, or having people staying here for long. It becomes costly also for the hospital. The longer the patients stay, or the more complicated their conditions, the hospital spends more. So it is an advantage also for the hospital.
In Shema District, Mohanga Health Center 3 has been contracted by the schemes, and the in-charge, Sister Monica Tuhaise Mukama, says that they have 556 beneficiaries from 187 families.
We have outpatient services, we have inpatient services, immunization services, counseling services, laboratory services. So all the services that the facility gives, with the exception of chronic conditions, are offered to these clients, and even maternity and antenatal services inclusive.
Here, the beneficiaries hold regular meetings to discuss issues to do with their schemes. Alan Katushabe from Ramujojo scheme, Shema District, wishes that the community health saving schemes could reach the majority of the population.
And for the case of services, we are getting services from different areas. For instance, this area around, many of us get our services from Mushanga Health Center 3. Then those with the chronics, they get their services from Kitagata Hospital. And for any problem which comes when you are in these health centers which are nearby, like Mushanga, then when they fail, they refer you to Ishaka.
The Executive Director, Save for Health Uganda, Makaire Frederick, says that the current National Health Insurance Bill that is before Parliament can borrow tips from the community health saving schemes to avail health insurance to people in the informal sector.
And we think that has prepared these communities to participate in the National Insurance Scheme when it comes. Secondly, people have now experienced because many people were fearing that when the National Insurance Scheme will come, how will the funds be managed, how will people participate in this scheme, and where will they get the treatment, the services are not of good quality. But now with the community insurance schemes, they understand that even if you have many service providers around, you choose the ones that offer you good service.
It is critical that health insurance, especially for the rural poor and the people in the informal sector generally, is given attention by the proposed National Health Insurance Scheme for the communities to pool resources to cater for their health care needs.